Hello everybody, my name is Nash, and in this video we will learn how to perform a CPR. So first and foremost, what is a CPR? CPR actually stands for Cardiac Pulmonary Resuscitation. This is a technique that we do whenever we want to save patients who actually underwent cardiac arrest or pulmonary arrest, or even both of them. So, question is, what is a cardiac and also pulmonary arrest? Cardiac arrest is a term that we give when a patient's heart stops beating. This means that blood has been stopped pumping simply because the heart is not working anymore. While pulmonary arrest is a condition we call when a patient stops breathing. So how do we treat both cardiac arrest and also pulmonary arrest? Do we refer to a different technique for this one? As a matter of fact, no. For cardiac arrest and also pulmonary arrest, we can use the same method, which is the CPR. Hence why we call it as the Cardiac Pulmonary Resuscitation, or CPR in short. This technique is very important, not only for doctors but also for nurses. Generally, everybody who is in the field of medicine needs to know what is a CPR. CPR is a first aid technique which is used not only in hospitals but most commonly on the streets outside from the hospital proximity. This is because in hospitals we have a different type of technology, a different type of device that can help us to bring back patients out of cardiac arrest. The device that you see right now is called the defibrillator. This is a type of device that we use normally in hospitals when a patient suddenly undergo cardiac arrest. However, this device is only available in hospitals. The likeliness of anybody to be carrying this around is very low. So that's the reason why we need to learn how to perform a CPR. The first step to do in order to perform a CPR is to make an assessment of the environment. If there's any dangerous objects or any hazards that are located around the patient, then immediately bring the patient out from the situation. The second step to do is to make sure that the patient is lying straight on a flat surface, preferably the ground. This is the reason why is because it will be easier for you to perform a CPR. When you want to perform a CPR, make sure that the patient is not at a high level so that it will be easier for you and your CPR technique will be more perfect. Next step is to make an assessment of the patient's consciousness. Tap the patients gently, either on the collarbone, and ask them if they are okay. Sir, are you alright, sir? Can you hear me? So this will be the first step. The second step is to observe for the patient's rib cage. If a patient is breathing, then you can see that their rib cage is moving. If the patient's rib cage is moving, then patient is breathing normally. If the patient's rib cage has stopped, means that the heart does not move, it shows that the patient has went into pulmonary arrest. After you observe the patient's rib cage, next step to do is to calculate and check for the patient's pulse. Unfortunately, I'm using a pillow, so checking for the pulse is impossible. But the techniques are pretty simple. You have to make sure that the patient's arms are like this and use your 3 fingers and search for the pulse. This is called the radial pulse. Afterwards, what you have to do is you have to make sure that the patient's head is straight. So when the patient's head is straight, you can observe if there's any blockage in the mouth or in the respiratory tract. Perhaps maybe the patient was choking. If the object is visible, if the blockage is visible, then you can remove it with your hand. Try to reach it and remove it. If the blockage is too deep inside the throat, then leave it. Do not attempt to pull it out with your hand. Only when the blockage is visible inside the mouth, then you can do it. But if it's deep into the throat, do not even try to attempt it. This picture demonstrates the head tilt chin lift. Now this is the type of head position that you want to do on your patient before performing this CPR. This allows the respiratory pathway to become straight, which provide better aeration for the patient to breathe. When you're ready, when the patient's head is straight, the airway is not blocked, the pulse is absent, and also the respiratory rate is absent, it shows that patient has went pulmonary and cardiac arrest. So the first step to do is making sure that you are in a comfortable position. Make sure that you kneel close to the patient's body. And now one of the most important part is the hand placement. When you want to perform a CPR, you must make sure that your hands are located at the right position. Use your other fingers to detect the bottom of the sternum, like you see in this picture. Once you detected it, the other hand must be placed on the sternum, or in other words, immediately above the finger. Since I am right-handed, I will be placing my left hand first on the patient's chest, and then followed by my dominant hand, which is my right hand. And make sure that you grasp your left hand. This is if you're right-handed, with your right hand, like this. If you are left-handed, then you should cover your right hand with your left hand. So, after you've done this, make sure that your hand placement is at the correct place. Once you've done that, make sure that your arms are straight. You cannot perform a CPR in this kind of state. You have to make sure that the arms are completely straight. Afterwards, you have to begin compression. Chest compression 30. Make sure that your chest compression is strong and quick. After you've completed 30 chest compression, observe if there's any changes in the patient's body. Perhaps patient maybe start breathing afterwards or not. If the patient is not breathing and there is no pulse rate, continue with mouth-to-mouth ventilation. When you want to perform mouth-to-mouth ventilation, make sure that the patient's nose is closed and the mouth is open, and begin blowing into the patient's mouth about 2 times. After you finish 2 mouth ventilation, observe if there's any changes. Maybe the patient starts breathing or not. If the patient starts breathing, then you can proceed with caring for the patients. If the patient is not breathing, then you should continue with your CPR. 30 chest compression and 2 mouth-to-mouth ventilation. If the patient is still not responding, then you must continue with your CPR until 30 minutes. If after 30 minutes and your patient is still not breathing, there is no pulse, then you have to accept the fact that the patient has already passed away. Also, when you are performing your CPR, make sure that you tell the people or bystanders or people who passes by to call for ambulance. In medicine, there are first aid kit, and normally inside a first aid kit, you will find this type of device. So this is the object that we place on the patient's mouth in order to prevent any infection or direct contact with the patient's saliva. So when you want to use this, make sure that you place it directly above the patient's mouth, and make sure that you breathe in through this barrier. Also keep in mind to press the nose and close the nostrils so that air will not pass through the nose. Make sure that the mouth is open and place it right above the mouth and start breathing from this hole. When can we stop performing CPR? Like I said before, if you have performed CPR for 30 minutes and the patient is still not responding, then you can already stop with your CPR. If you are performing your CPR and the patient begins to breathe normally and you can already feel the pulse at the patient's radial artery, then you can stop performing the CPR and turn the patient to the side in a recovery position, which I will show later. In this picture, you can see the recovery position. In this position, the patient's head will be placed underneath the head to support the patient's head, and the knee to stop the patient's body from rolling onto their stomach into a prone position. This position helps to prevent the patient from aspiration in case the patient starts vomiting.